I am going to ask Ajay to begin. Come on down. You'll never know if you don't
It was a childhood dream to walk up the stage with that song. If we only could get maybe Michael Jordan for me to play a couple baskets of a couple of basketball hoops, then that would complete all my childhood dreams. Maybe next year, right, Dr. Joe?
Yes.
All right, so my name is Ajay Kohli, and I am a medical student at Drexel College of Medicine, and I come to you to present a platform that we are working on to address and monitor patients with heart failure in using readily available technology as well as enhancement of the physician-patient relationship. But before I go in to talk about what exactly we're doing with our platform, I want to very briefly mention what exactly is congestive heart failure for the non-medical people in the audience. As it turns out, your heart is a muscle, right? And over time, the heart muscle gets tired and it can't pump out blood, and it can't relax so that it can collect blood, so that it can go on to further pump it out. And when it cannot do that, the blood is ultimately stuck, and it's stored up as fluid within different parts of the body, within the lung, within the extremities, within the legs. And when that happens, patients have no choice but to go to the ER, get diuresed, and ultimately pee all that extra fluid out. But turns out this solution has led to a 1 million rate of congestive heart failure admissions each and every single year. And patients with heart failure, although are only 10% of the Medicare population, they account for over 1/3 of the spending. We know this isn't working. This is not sustainable. But before I really go into the numbers, I want to give a very quick introduction of a fourth-year medical student's analysis. So in my career so far, I've had 24 patients with heart failure. And in a retrospective analysis, admittedly basic analysis, I saw 24 patients in the ER. All of them were admitted into the medicine wards. 20 out of the 24 were readmits. And 17 of these patients ultimately had an end-of-life scenario discussed within their hospital stay at some point in their lifetime. I thought this was standard of care. I was learning from my attendings. But suddenly, I met a 25th patient, and I had an interesting interaction with that person. Turns out, this person was my beloved grandfather. He was suffering from congestive heart failure as well. And he would also have doctors who would come into his patient room and say, "Oh, we need to talk about your end-of-life situation. You've been hospitalized multiple times." My grandfather, he was a warrior. He suffered through the genocide of the India-Pakistan division. He suffered through, and he went on to raise 13 kids and grandkids who are all doctors and 5 engineers and 2 lawyers. He's like, "Fluid? Psh, I got this." But the doctors, unfortunately, did not feel that way. And turns out, he passed away because of congestive heart failure. This was my calling, and I knew I wanted to develop something so that I could address this, because congestive heart failure is not a terminal disease. Congestive heart failure is something that can be managed well and can prevent exacerbations for our patients. So what did we do at our medical school? We developed an app. We allowed our patients to monitor their symptoms, their weight and their breathing in a quantitative way, and how do they feel in a qualitative way, so that we as physicians could monitor and build decision engines and algorithms to actively identify which patients were worsening. And then we could reach out to them before the problems were to arise. We realized, though, that there could be a couple of problems towards implementations, and I like to call these opportunities for growth. And scale is the number one thing. And to address this, we're currently in talks with local area insurance companies to work on better management of reimbursement. And to address issues of non-compliance in a non-native population, in a non-smartphone native population, we are also working with our engineering department to build wearable devices so that we can monitor peripheral edema, we can monitor signs and symptoms without the patient having to manually enter that within a smartphone. And finally, getting to the heart of the matter, pun totally intended. As a clinician, I see patients with heart failure every single day. And I signed up to become a doctor so that I could be there for patients in their hardest moments of their life. And when I see them suffering, I want to do something, anything. Even if it may not lead to the complete resolution of the problem, I want to attempt to find something. And that is what we are doing with our app today. Thank you. And before very quickly, I just want to say a big thank you to the American Resident Project, Dr. Joe, special thank you to Dr. Joe and John and all the wonderful Medstro team for inviting us, for setting us up. You guys are awesome. Enough said.
And if you didn't see his really cute YouTube video, you need to watch that. Judges, do you have some Jack Handy deep thought questions for our friend Ajay?
Fantastic. Thank you so much.
Thank you.
One of the things you mentioned, heart failure, and we know that so many of these patients have got so many other conditions. What are the patients telling you about their other conditions when they're using this app? Are they asking you about using it for other things, using it for diabetes, blood pressure? What are they kind of feeding back to you about using the app?
So we only have 3 variables, 3 sort of yardsticks to determine how exactly the patients may be going through. As I mentioned, we're trying to enhance the physician-patient relationship. So the 3rd variable was mood. How is the patient feeling? So when we realize that the patient is in a crummy sort of mood, we reach out to them and we see what exactly is it that's making them feel crummy, making them not compliant. And that is when we ask about other conditions like diabetes, like asthma, like COPD. So although we have not had a chance to directly address the other chronic conditions that tend to go hand in hand with heart failure, that is certainly next on the agenda. Excellent question. Thank you.
Great presentation. Good job creating this app. So I have 2 questions for you. One, are you teaching patients to use this app as inpatients when they're admitted in the hospital, or at the time of discharge, or when they come to visit you in the office?
So as of right now, we've developed a pilot with a very few amount of patients, and so we've dedicated some exclusive time where we go into teaching the essentials of the app to the patient itself. And we hope that once we expand and we would have already identified some of the problems with our test focus group so that we can see what will be the best strategy towards mass implementation. But we think an office situation where you have a one-on-one interaction will be the best way to go, and not as opposed to an inpatient location.
Great, thank you. Second question. So what has been the average learning time? Like, how long does it take for the patient to learn how to use the app?
I have not measured that metric, so I could not give you an accurate answer. But the way that we designed our app, the way that we, and even with the questions that we were having the patients monitor, we wanted something very simple. So weight could just be tap, 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 enter exactly what your weight is. And then even with your respiratory symptoms, it was just, is it better, worse, about the same? And then about the mood, we have a few variables that we're trying to determine that as that we help the patient try to quantify that in the best way possible. So to answer your question, it doesn't look like we have that metric with us, but we think that we've made it so simple, we don't want that to be an issue going forward.
Great, thank you.